Welcome to the Pit Crew. I'm Camille, your attending, and I have my residents with me.
I'm Mal.
And I'm Robert.
And today we are covering Season 2, Episode 8 of The Pit, 2 p.m., and we are retitling it, This is the Dark Ages. And today's patient presents with a bit of tongue. I got a blooper on my tongue.
I know way too many white blonde women who get drunk like that.
Really?
Yeah.
You also know a white blonde woman who, as a baby, did that exact same thing to her tongue and still has a scar.
Ew.
Me. Yeah.
You got blackout drunk as a toddler?
No, it was my father's fault, by the way, because, fun fact, my father was like a 24-year-old man, which is insane to me. That I was like, why were there 24-year-olds raising me? That's nuts. But he had a grapefruit, and I wanted it because it looked like a ball, and I went for the grapefruit and fell and hit my chin on the table and bit down on my tongue and almost bit my tongue in half as a child. And
oh, brother.
They took me to the ER, and they were told that they don't usually stitch up tongues, so to watch them stitch up a tongue was crazy. Also, I attended CPR training today, so I am really ready to dive in. And all those people who are you should get a medical professional to come on the podcast, that's me now, guys. I'm a medical professional. I can do CPR.
I'll be sure to have a heart attack the next time I'm around you.
They call her the rib breaker.
Yeah, I'm very strong. I've been going to the gym. I've been lifting, so I can do CPR really good now.
Yeah, brother.
Should we do our little bit of housekeeping, aka environmental services? Now that we have a certain amount of followers, there's always a little bit of housekeeping to do at the beginning.
For starters, happy 6,000 followers on Instagram. Damn, we are growing at a huge fucking rate.
It's a little overwhelming, honestly. I'm like, oh my gosh, there's so many people now listening to us just be three friends yapping about media we enjoy. We're so grateful that all of you are here and that you enjoy our nonsense, because that's what it is. Nonsense.
Well, last week we hit 1,000 subscribers across all platforms, and now I think we're over 2,000.
Yeah, crazy. We have over 1,000 just on YouTube, and I'm like...
Yeah, we're growing at quite the rate, y'all. Thank you for liking our little show.
Yeah, and I think, so a lot of the listeners very recently have come from our Heated Rivalry coverage. Now, I know that there are people who like listening to our episodes on the Pit and do not care about Heated Rivalry. That's totally fine. We've talked about it before, to each their own. You do not have to listen to those episodes. We get it.
Listen to what you want to listen to. Life's too short.
Some people are like, oh, they should have it on a different feed, and it's does it really matter?
It doesn't really matter to us. If this was a big professional thing, I get that. But again, we are just a group of three friends. And so I did just want to say, we have decided we are going to continue Heated Rivalry coverage. We're kind of going to be doing a book club sort of a thing where we're going to release a syllabus of the chapters for each week so that you can read along with us and discuss.
And hopefully that'll carry us to season 3 of The Pit.
Oh, it will. So I will say, yes, you are going to continue to see that on your feed. I'm sorry if that's not something you're into, but, this is our podcast and we're having a great time. We've heard a lot of really complimentary things from people about those episodes. We're not interested in stopping that. And I get it. If a podcast I liked started talking weekly about something I could not stand or wasn't interested in, I'd be annoyed. But just keep in mind, that is the thing we're going to be doing. We're really enjoying it. We're having the time of our lives.
And we still enjoy the Pit.
We love the Pit.
It's not going to take away from our coverage of the Pit, so...
Exactly. We actually have heard from people who are fans of Heated Rivalry that because they enjoy listening to us talk about that show, they're going to start watching the Pit. And so, it's good all around.
Are we influencers, guys?
No.
And likewise, if you're someone who was only interested in the Pit and you're now starting to also listen to some of our Heated Rivalry episodes, by all means, you're welcome to. We just enjoy what you want to enjoy. This is a fun little thing. A lot of people like to comment and say, oh, I feel like I'm listening to my friends yap. And I'm like, that's just the vibe we're going for with this podcast.
Yeah.
Because we are just friends yapping. That's what this is.
And it's been so cool for the Heated Rivalry episodes. We've had some really cool friends of ours come and join those discussions and bring a lot of really good info. social work info and trauma therapy info and stand-up comedian info. No, we have a friend, she worked in film for a bit. She went to film school and had, got a degree in
Well, she was
writing,
also
and so
on the Pit last week, but
yeah, and she talked about the pit with us. And so I just wanted to say, like, I understand things are a little different on the feed, but stick with us. We're still going to be talking about the pit. We just have other interests too that we wanted to share, and it's been a lot of fun. So that is going to continue to happen.
okay, wait, sorry. Have you guys seen the thing on Threads about the woman who thought that the Pit was about a Pittsburgh themed hospital in Hawaii?
In Hawaii, yes.
I did not.
Robert, you don't know this? Oh my God.
I have not been on Threads in a little bit.
Yeah, it's kind of a meme that's going around because this woman like tweeted that or not tweeted,
Threaded.
Thread is it.
Put on Threads that she was like watching the Pit and was really confused because she's like, this is a Pittsburgh themed hospital in Hawaii. She saw the Ho'oponopono bit and like I guess assumed that it was like in Hawaii, and I don't know, it's just deeply amusing to me the idea that there would be like a Pittsburgh themed hospital. I just crazy. Like what a theme.
Media, like I that it's very charming, but media literacy is fucking dead. What are you
Well, no, I don't
talking
even think it's media
about?
literacy. Like, I think this was a prior to consuming the show, she got this idea and
I
then
was
watched
like-
the show and was like, wait, that's not what it is.
If you're someone who goes on Threads or Twitter or whatever, and you're like, guys, Robbie wasn't wearing his helmet in the season
Oh
2
my
premiere,
God.
but he says he does. Why is he lying? I'm like, guys, oh my God.
No, I'm starting a collection of people with really bad takes about the Robbie helmet situation. And I found like, the attention to detail is just not there this season. Like, why is Robbie not wearing a helmet? And I'm like, guys, they're telling you something about his character in doing that. And what they're telling you is that man is suicidal.
That man wants to know what the pavement tastes like, okay?
Should we dive in?
Yes. Okay. So we are, of course, I say this all the time, and then I'm like, yeah, duh, Camille, that's how the show works. I'm like, we go right back in. We pick right back up. Yeah, no shit. We pick right back up with Robbie being a bitch to Dr. Al for not having warned him. And this is a take
Robbie hates women.
Robbie hates women. I have seen this take online so much, is that people are like, she should have warned him. I don't understand why she didn't warn him. When?
No, she
When would
literally
she
came
have
down
warned him?
with the CEO. It's not like she had this information. Like,
Right.
Part of me is like Robbie's being an asshole, but also part of me was like, okay, she was specifically called up to deal with this because she's had experience with cyber attacks. And so when Robbie is like, okay, then you should tell people what to do, and she immediately deflects, she's like, no, it should be the head of the department. He's like, oh, you fucking think? I can kind of see Robbie's anger.
but keeping him in the dark, like, I don't think Dr. Al was in the wrong. I think the CEO was in the wrong. Like, he should have warned Robbie before he was going to tell everyone else, Like, I mean, and I guess they didn't have that much time because pretty quickly the network goes offline, but like, I don't know, it's weird to announce something to the entire hospital that like Robbie has no idea about, especially because Robbie was like, do you have anything you want to tell me? And the CEO guy's like, no.
By the way, it's important to remember that the CEO went directly to the emergency department and announced it. There's a whole ass other like 90% of the hospital who also went down, like all their systems went down, and presumably no one's told them.
Maybe he's been making his way down.
It's like, oh, don't worry, he sent an email.
So emails no longer work.
This email should have been a meeting, guys.
They start setting up, like Robbie brings out a whiteboard and they're like, okay, we're going to go old school with this. Please, for the love of God, tell me someone took a photo of the board.
Of fucking course, Whitaker's picture is blurry. And I love, like, the old man of it all. Like, this man is so young, and yet the first picture we see is, like, a close-up selfie of his face and then the blurry-ass board.
This is, somebody online was like, what do you mean his name is Dennis? And I was like, this is a Dennis moment. This is
is a
Dennis
Dennis move.
behavior.
Good job, Dennis. It's blurry as fuck. The patient board, like, no one will know except Joy because she has photographic memory.
I love this.
My God, yeah.
I love this, but this also feels so Deus Ex Machina of like, guys, we're fucked. Actually, we're not. I have photographic memory. I'm like, cool. This is something that was not brought up at any point throughout the past 8 hours. Like, honestly, it wouldn't have. There would have been no moment to bring it up, but at the same time, it's just so random.
When she said that, though, I had a moment where I was like, oh my God, she has spent a lot of time looking at the board, though. Now that I think about it, I feel like we've had a lot of shots of her standing there with her hands in her pockets looking up at the board. Like, that's a very familiar frame in my head, you know?
Yeah.
I was like, oh God damn. I didn't even notice they were hinting at it. It was coming. And of course, Dana is still with the survivor. So Princess has to take over all of this. This is Princess's very bad, horrible, no good.
Princess of the terrible, horrible, no good, very bad day.
I don't remember who said it, but someone was like, oh, Princess has Chartreuse experience. And Princess is like, not this much. Nope, get the fuck away from me.
I think it's Perla. It's always Perla.
It's
That's
always
like Princess
Perla.
can do.
Perla is instigating.
Perla is just constantly throwing Princess under the bus affectionately.
Dana, of course, is stuck in the triage room until she finishes that exam and seals the rape kit. So Robbie tells everybody to go check on their patients, and finally, Harlow gets some attention.
Thank God.
Now, I thought this was actually, like, this plot point I thought was very interesting. We find out that she works from home. She looks down at her computer a lot rather than having it at eye level. And so Santos does like a physical exam to see, you know, if she's having any pain in her neck. And where she presses on a certain muscle, like, causes a lot of pain. She's like, okay, cool, we can do a trigger point injection. Did anybody else pick up on the significance of that? That is the very first thing that she does to piss off Langdon in season 1, is that she did a cervical trigger point injection without presenting the case.
Oh.
So later in this episode, when Langdon is like, good job on the trigger point.
Oh.
Isn't that cool?
That's fun.
Yeah.
Thank you to the PITT details for remembering that
You're
detail.
welcome.
My question is, because, okay, fine, like a certain muscle hurts and probably like the headache can be explained from looking at screens all day. Why does her stomach hurt? Because that's also one of her symptoms.
Wasn't it because she took like Tylenol on an empty stomach or something?
Basically, they're saying it's GERD, so she needs an antacid. But like, I still feel like this isn't quite, I mean, I hope it's right, but something in my brain is like, what if this is not what it actually is?
I feel like it is that simple because I was sort of frustrated I was like, God, it was that easy? Like, this was so quick
true.
once we finally were able to communicate with her that I was like, God, like, we could have been done with this hours ago. Like, when she first came in, like, I think that's the point of this interaction. And maybe I'll eat my words next week, as I often do. But I don't know. I think like the point of the interaction was just like, this was not a big deal. Like, this was an easy fix, and like it could have and should have been dealt with a lot more quickly. But there were, challenges.
Mm-hmm.
While I think that's a satisfactory resolution to Harlow's story, is that it was very simple and she could have been out of here hours ago if not for the inadequate care she was getting. Part of what seemed to be the buildup is that, like, oh, okay, Harlow is here for some reason. We find out, okay, it's a headache and stomach pains that seem to be advancing, ? We don't know because like the VRI turns off, like it's like it just stops working. Part of the intrigue of the Harlow story was that perhaps she has something very bad wrong with her, and because she's not getting attention,
She's gonna die.
and because she's not getting adequate medical care, she's gonna die. Like, yeah, that was like the big thing that a lot of people were thinking. And my thing is, I think there have been a couple of stories so far where it seemed like it was going to elevate to something really extreme. And then almost immediately, like when you're at that point of thinking like, oh shit, it's going to get really intense next episode, they solve it and it's done. And I'm like, this isn't like Grey's Anatomy or whatever, where like the drama gets pushed up to 12. It's the PITT is set more realistically than the other medical
She
dramas
has a tummy
that we
ache,
watch.
and it's because she's got a gun in there. She's gonna kill everybody.
There's a bomb.
So like on one hand, I'm like, okay, cool. They resolve the story quickly and Harlow doesn't have to suffer anymore. And then on the other hand, I'm like, okay, there was all this buildup, and it was just something simple, but it's, it's not just simple. It's also commentary on like people who are in Harlow's situation don't get great healthcare a lot of the time for a bunch of different reasons. And like, yeah, great. We have commentary. That's commentary we need. But also, I feel like maybe we kind of pulled the rug under what could have been, I don't want to say more interesting story, but like, it felt like it was building up to something bigger.
I think it did, but I think that we're used to shock and awe.
I'm like I disagree. I like where I like that it was an easy fix because I think that's what the story was supposed to be.
Yeah, I think that's it. They proved their point really well by just being like, look at how fucking simple this was. And she's been here since episode 1. So, another thing is that I've seen a lot of people online, like, why couldn't they just give her a pen and paper? You can't legally do that. That's not appropriate. Like, it doesn't hold up. So, people have explained online, one, that legally you can't do that. And then two, also, that is not the language that she uses to communicate with primarily, and she has the
Mhm.
right to request someone who can communicate using the language that she uses. American Sign Language is a language, it's literally in the name. That's why. It's not that simple. It's not like everyone's trying to make her life hard or anything like that.
Even using the VRI technically isn't what Harlow was requesting. Like, yes, the man on the monitor was using ASL to communicate with her, but it was a technology that could fail and did, obviously, which is why she didn't request it.
I think that the point is more like it's not on Harlow to figure out how to communicate to them. It's on them to figure out and accommodate her. It's a reasonable accommodation.
Oh, 100%.
Mhm.
So,
Beyond reasonable. It should be expected. It's, hey, this is just somebody who needs to speak in this language. Okay.
Robbie and Avid are giving yet another masterclass on like the game plan. Here's how things work. Here's how we do things, teaching everyone how to do something. And they're explaining this whole analog system and like how to chart and where to put things.
The system for getting charts feels so convoluted. Like this is for trauma, this is for just medical stuff. This is like where the bug bites are. And I'm just like, I wouldn't know where to find anything. Like I was getting stressed as they were doing all this, as if I was the one who was going to have to be doing. I feel like unprepared for a pop quiz.
I thought it was really laid out, like really well laid out. Like it made sense to me because I was like, okay, this is a trauma patient from head to toe, the kind of chart you would need based off of where on the body the chief complaint is. And then on the right side, you had just a regular patient from head to toe, where's the chief complaint? But I love that McKay is like, are those fish and seaweed? And Avid's like, no, they're grass and bug bites, like allergens. I thought that was very funny. I'm sure that like people like Abbott and Robbie who've done this before in their careers, or like even Dana, right? Like this was the standard at one point for them. I'm sure it's a breeze for them. Like it makes total sense to them. But boy, oh boy, does this suck for literally anyone else. Like the layman's example that I would equate it to is like ask a Starbucks barista if they know how to write on a cup anymore. Probably not. Like the abbreviations are not really like it's something you learn, but like you never really have to use that.
Yeah.
So Dr. Al gets in on teaching everybody. Santos asked about the AI program. And Robbie has this smug little laugh that made me want to kick him in the shin.
Okay, so it feels like a really stupid question for Santos to ask because of course you're not going to have the AI program when all the internet is down. So like I feel like it's sort of a joke almost. And Robbie certainly takes it as a joke. Like it feels cuz it also made me laugh her being like, "Are we going to have your AI program?"
I don't think she said it that way though.
Yeah, no, I was going to say, I didn't think she was joking. I thought she was like,
Actually asking.
she was like reliant on this program to get through her charting. And she's like, hey, does your AI thing still work?
Why would the AI thing work on paper charts? Like
That's
it's
such a
just
good
it's like
question.
it's a dumbass question. And so it comes off to me as like she's sort of poking fun at Dr. Al and her like pressure to use this AI program that like immediately became obsolete, you know?
Santos is desperate to finish her fucking charting when her shift ends. She doesn't want to spend another hour or two at the hospital. She wants all the shortcuts. So she's hoping somehow, some way, this miracle magical AI dictation software survived. And unfortunately, it's dead. R.I.P.
Dr. Al also tells everybody ditch your SpectraLink phones. They're not going to work. It's voice over IP. And the incoming runs are through the charge nurse phone, that like regular degular old red phone that rings out loud and it annoys Santos later in the episode. Like, she can't think straight because of hearing it, which I think is interesting. Larry and Antoine are the clerks, and they're responsible for a lot. And Javati has a look on her face like, these idiots? Like, are you kidding me? Which is tickled me. I know, as someone who runs a fan page, that people decide, like, people think that I am Mr. Warner Brother himself, because the amount of complaints that I get in my DMs and in my comment section about things that they want to see on the show and all this other stuff and critiques they have, and I'm like, I don't know who you think I am. I know people are going to be fucking thrilled to see a
What if we
pharmacist in this
just
episode.
called Mr. Warner Brother up?
Mr. Warner Brother.
Camille, clearly, so they're the Warner brothers and you're the Warner sister Dot.
The Warner sister what?
Dot. Oh my god, you guys have never seen Animaniacs, have you?
No.
No.
Pain, agony, despair. My socks are wet. Oh god.
So we have Dr. Megan Nord. She is the clinical pharmacist there for the ER, and she is unlocking the PDS, and she's going to be standing there dispensing meds for the entire department.
Oh, she's going to be standing there.
Initially, I had a theory that I shared with you both that I'm glad has no ground to stand on, which is where I was like, okay, in the next time on the pit we got for this episode, we have a scene of Dana being like, are you fucking kidding me? And so I thought the PDS was like down or like had to be forced open. And I was worried like, oh, it would just be like an open PDS where anyone could take any medication. They would have to chart it, whatever.
Right.
Oh, God.
I was worried that they were going to have a like subplot of either Langdon relapsing or Robbie thinking that Langdon was back to his like stealing medicine ways, and that would have been a whole thing. And I'm so glad that theory is dead in the water.
As they're introducing this pharmacist, Mel waves at her and she's like super excited. And Dr. Al is saying, any questions, while Mel is waving. And then she goes, yes. And Mel is just like, oh, no.
I love Mel. She's everything to me.
When you're about to open up a bed, you ring the bell to let everybody know there's about to be an open bed.
Or that your tuna melt is ready. And this is Santos as a Heated Rivalry fan confirmed. I can't believe Heated Rivalry invented tuna melts.
Ilya Rozanov made the first ever tuna melt ever.
It's incredible.
I can't believe a bisexual Russian invented tuna melts.
Who actually invented tuna melts? Who are we to say it wasn't a bisexual Russian?
Also, Abbott seems so excited to be like, that is a fax machine. Because they're like, what is that?
The joke earlier a couple episodes ago being like, who's Dr. MacGyver? Like, that was funny. Whatever. We're in the age range of these characters and we know MacGyver to some extent. That's fine. We're also in the age range where we know what fax machines are. Fax machines were a big thing still in the 90s and 2000s and 2010s, and they're still used by a lot of different places now. I definitely remember fax machines in this sort of like, oh, my parents used it when I was like 5 or whatever. So the fact that these kids, they're all the same age as us pretty much, the fact that these characters don't know what fax machines are is so funny to me because it's HBO. It's the Warner Brothers being fucking boomers and being like, oh, Gen Z doesn't know what fax machines are.
Well, and I also think that like old media is so accessible to us. Like you can watch shows from the 80s, the 90s, like just on streaming, and you can read books from like, I feel like if you don't know what some of these things are, I'm just like, have you never watched Friends? Like, have you never consumed old timey, like maybe you should. You learn things about different times.
I'm only 31 and I've sent faxes. I mean, I will say most fax this day and age is electronic. So you scan it into your computer, attach it to an email, and send it that way instead. Brother, come on.
There are also, unfortunately, some scenarios in your adult life, even in the modern age, where you will need to fax an important document or some tax form or some form of payment, because there are some companies that refuse to modernize and like work on emails or whatever. You either have to fax it or physically mail it in sometimes. And that's an experience. I sent my first actual fax in a fax machine when I was like 24.
Oh my God. So Howard Knox is 52. He has abdominal pain and a fever, and he's coming in through the ambulance bay. He's very overweight, and Ogilvy.
Ogilvy.
I hope he knows how lucky he is that his legs are long. Otherwise, I would be beating the shit out of that man. I'd have tackled him already. They say they couldn't start an IV, and he says, "I wonder why," which McKay clocks immediately.
Why does he have to be such a dick in every situation? Like, truly, every episode, I'm like, maybe this is the one where he'll grow on me, because, like, I didn't love Joy in the beginning, but now I kind of think she rocks. And I just, like, keep hoping that the Pit is going to endear Ogilvy to me. And every episode, oh my god, he just gets worse and worse. And I'm just like, when will he die? I need him gone.
Can we just make this Grey's Anatomy for one episode? I just need to request one death, please.
One episode.
Now, this was from June of 2010. In a medical journal, it was called Obesity Stigma Important Considerations for Public Health. It was by Rebecca Poole and Chelsea Hewer. And so I wanted to read the abstract from this. It said, "Stigma and discrimination toward obese persons are pervasive and pose numerous consequences for their psychological and physical health. Despite decades of science documenting weight stigma, its public health implications are widely ignored. Instead, obese persons are blamed for their weight, with common perceptions that weight stigmatization is justifiable and may motivate individuals to adopt healthier behaviors. We examine evidence to address those assumptions and discuss their public health implications. On the basis of current findings, we propose that weight stigma is not a beneficial public health tool for reducing obesity. Rather, stigmatization of obese individuals threatens health, generates health disparities, and interferes with effective obesity intervention efforts. These findings highlight weight stigma as both a social justice issue and a priority for public health. Negative attitudes towards obese persons are pervasive in North American society. Numerous studies have documented harmful weight-based stereotypes that overweight and obese individuals are lazy, weak-willed, unsuccessful, unintelligent, lack self-discipline, have poor willpower, and are non-compliant with weight loss treatment. These stereotypes give way to stigma, prejudice, and discrimination against obese persons in multiple domains of living, including the workplace, healthcare facilities, educational institutions, the mass media, and even in close interpersonal relationships. Perhaps because weight stigma remains a socially acceptable form of bias, negative attitudes and stereotypes towards obese persons have been frequently reported by employers, coworkers, teachers, physicians, nurses, medical students, dietitians, psychologists, peers, friends, family members, and even among children aged as young as 3 years. So that was a mouthful, but I wanted to read all of that. This show does a great job of showing us a lot of people that the system has failed. And so again, I think, we saw this in the mass casualty last season, is that there was a man who was a little overweight that came in as a gunshot victim, and they couldn't place the IO. Remember, they had to go to his leg. And so I think this show does a great job of not feeling preachy when we address these topics, right? There's always something to learn. Like, we're in a teaching hospital, so we're going to learn. Hold on to that information as we move along. But everybody is already struggling. They're all kind of commiserating around, Central. And Abbott says that this is one of the best moments of the episode, by the way. Abbott says that this is how they did things when he was a resident, and Joy absolutely fucking destroys this man by saying, "Was that in the 1900s?"
That was barely 30 years ago. Like, I feel like if you wanted to really destroy him, you'd be like, was that in the 1800s? Like, really go with the hyperbole.
If you want to be hyperbolic, you go like, "Oh, was that when you were fighting dinosaurs or whatever?" Like, you really want to make a funny joke out of that. However, his retort is equally, if not more funny.
He says, "Yeah, when charts were written by candlelight."
No, his retort is so good.
Jack Abbott is 100,000 years old.
Anyway, so when I saw the next time on the Pit, and Langdon makes his little joking thing of like, "Guys, think of it like an adventure. It's like Back to the Future." I clocked it. I'm like, my favorite movie is Back to the Future. What is the context for this scene? And the context is, guys, using analog technology will be an adventure. It's like Back to the Future. No, it's fucking not. Langdon, have you seen Back to the Future?
If this is Back to the Future, someone has to try to fuck their mom, right? clown to clown.
It's also really funny to me that the first like adventure movie he can think of is Back to the Future. Like, yeah, sure, it's an adventure movie. It's about a kid who gets sent back to the 50s by accident. His whole adventure is trying to get back to the 1980s, the future. Ooh.
Oh, God.
It's just so funny because sometimes shows will just make pop culture references for the sake of making a pop culture reference. And a lot of the pop culture references in the pit have been, you know, more so about like actual real life events, tragic and otherwise, that have happened. And also occasionally they'll be like Dr. MacGyver.
Spidey sense.
Yeah, Spidey sense. But this Back to the Future reference, I'm like, what was the joke? What was the, like? I don't get what they were doing. I know what they were trying to do. They were trying to make like Langdon's making a little joke, and then he knocks over the folders next to him, and that
All
like
the charts. Yeah, the rat.
Well, and also, I don't think Mohan's response about like, or Titanic is that good either. Like, that doesn't make any sense to me either.
The boat is sinking and everyone is dying. It makes plenty sense.
that makes more sense than Langdon's. Oh, it's like Back to the Future. I'm like, God.
Harlow is getting her antacid, and Santos is going to do the trigger point injection.
I thought it was very cute the way that Santos says cheers, and so the interpreter signs cheers, and then Harlow like rolls her eyes.
I didn't even catch that. That's amazing. Oh my god. Oh my god. But again, like this is what got her on Langdon's shit list on day one. In the morning of day one, I think it was like 8 a.m. or something. This is what got her on his shit list. And this time, she doesn't have to present that to anybody. Like, she doesn't have to ask permission. She can do that unsupervised, quote unquote. There doesn't have to be someone there with her. So we're back in trauma with Howard, and he needs a CT. But this is where his weight starts to come into play. He also can't lay down flat without struggling to breathe because of his weight. So they're going to have to intubate him through his nose so that they can weigh him and then also so that they can scan him. So they ask him what his weight was, and he says he was a little over 400 pounds the last time that he was weighed, but then admits that it's been a while. And so he apologizes for his weight. And I love the fact that Robbie's like, it's all good. No worries. I love he's so well taken care of in this scene by all of these doctors, except Ogilvy. So they huddle off to the side to discuss it because it's a sensitive matter. And again, like they don't want to discuss this in front of him and make him feel bad for something that he really can't control. There's nothing he can do about this right now, right? And so I do like that instead of discussing it over him, they do step aside because they're like, we're not here to shame him, whether like purposefully or inadvertently. We find out that the CT at PTMC can only handle 450 pounds. So they're going to have to weigh him before they can put him in the CT to make sure that the machine can handle it. Ogilvy?
I hate him.
Yeah, I'm going to take him to the zoo and I'm going to throw him in there with the gorillas.
Yeah, gorillas.
With Harambe.
Yeah.
R.I.P.
R.I.P.
R.I.P. to Harambe.
My favorite long-lasting meme has always been like, "Oh, Harambe getting killed is what set us into the bad timeline."
Bad timeline.
I will say, because I know I've heard about this somewhere, in very rare circumstances, yes, if you are overweight and no nearby hospital or the hospital you're in has a CT or equipment that can handle your weight, yes, you could be brought to a zoo that has CT and other machines that can handle a bigger body person. That is not like automatically the first thing you should think of.
And also, don't say it like an asshole.
Right, no, because of the way that Ogilvy has been with this guy, like, you know it is because he is looking at this guy as animal adjacent. Like,
yeah.
It's like if it had been it's so interesting because like if another person had made this recommendation, it would like seem almost logical. Like it could, like if Robbie was like, okay, he's gonna have to like go to the zoo to like use their big machine, whatever, because he would present it in a respectful way, but you just know with Ogilvy, he means it disrespectfully, and I want to fight him. I want to kill him.
If someone else said it, it would have been affectionate. If Ogilvy says it, it's derogatory.
Yes.
Literally.
Ratman derogatory. Well, my only other question is, did anybody else in this moment think for a second, is he on the spectrum? Because he genuinely seems to have trouble with communicating, and I don't know if that is malicious or I think he's also, like, he's definitely an asshole no matter what, right? But is he an asshole and also autistic?
Maybe, but also if you're gonna be an asshole, regardless of any neurodivergency, like you gotta.
Oh, like, I don't forgive you because you're neurodivergent. Like, you're still being an asshole. But I just had this moment of wondering, like, because I'm not quite convinced that he was saying it to be an asshole, but I'm just like, wow, where is your filter? That's an
Yeah.
inside thought.
No,
Like,
that's true.
I think either way, he said it with a lack of empathy of
oh,
Yeah. No, for
of
absolutely.
sure.
the situation at hand. Like whether or not he's neurodivergent or he's just an asshole, it's still just
Yeah.
sort of
Right.
shooing him out of the door, being like, okay, we can't deal with him. Let's move on, kind of thing.
Mhm.
So, Presby, we are not going to go to the zoo, Ogilvy. Presby has a CT that can handle up to 650. And then, of course, Whitaker jinxes everybody by saying that Presby's still up for now.
That is what, the fourth jinx in this shift?
Ratman, mildly derogatory.
Yeah. Whitaker!
So Joy is still going off listing patients, which is just insane how much she's retained. Princess is in way over her head. Roxy's parents arrive. The moment that she has with her dad really got me.
Ugh, I know.
I got choked up. Her parents are just like emotionally so much better at handling this situation. It seems like they're coping. Like you kind of have to pre-grieve in these situations, and it seems like her parents are doing a lot better. I understand the stress that her husband must be under. I understand that he doesn't want to lose his partner, but at the same time, I'm like, you're still a father, and you still need to figure out how to cope. Everybody else is coping better than you are, and you do need some help.
Also, we get it confirmed that her son's name is Shane, not her husband.
We
Whoops.
got a comment on our last episode, like that somebody went to IMDb. You know what? Yeah, we made a mistake, but I just took the opportunity to reply, you know what? Fuck them kids too.
Well, and we also like don't have access to IMDb for the episodes yet when we review them, so sometimes it's hard for us to look up an actor because it's like not on there yet. I still don't know that man's name. If it's not Shane, what is it?
So Roxy is totally exhausted, and so her parents are like, we're just gonna go get ice cream, and we'll take everybody with us.
Thank God, because why did this man bring these kids here?
Good Lord. This moment is another moment that I got a little choked up because Roxy's dad is like, can she have ice cream? And Javati says, yeah, she can have anything she wants. And that really got me.
That was the moment that I was like, oh, she is not making it out of this episode.
She's definitely still alive at the end of the episode.
Did you get a bonus scene?
I meant she's not making it out of the day, but then I said the episode. Yeah, the season.
Especially with what Robbie says later, I'm like, oh yeah, no, she's definitely not making it out of. There's a lot of people who want to talk about like the ethics of assisted suicide, and I'm like, yeah, no, fantastic. That's not going to happen because it's illegal in Pennsylvania, but you know, fun little thought to have, I guess. TM. We cut back to Howard. They ask him what medications he takes, and then Ogilvy just starts listing weight loss meds, and I'm like, Ogilvy, shut the fuck up.
I want to kill him.
One of the things I really like is that the detail of Dr. McKay handing him a tissue in case he needs it. That's so important. She's very compassionate and thinks about what people may need in the moment.
Just something that he really needs to learn from her is that
Yes.
she's noticing these little things of like, they're putting something in his nose to numb it, so he might need a tissue, and I'm going to hand him a tissue just in case. Like, it's all about dignity with McKay, and that's one of my favorite things about her, is that she respects, like, she protects people's dignity at all times.
Yeah. And I think McKay has had, I feel like, less focus this season, or maybe it's the same amount of focus and her storylines just aren't speaking to me in the same way that they were last time. Like, I don't feel like I'm focused on McKay this season, but I feel like this was a little like sprinkle of like, McKay, for me, which I appreciated.
Ogilvy starts talking about like exercise, water aerobics. None of that's gonna fucking help him right now. Like, God, Robbie, it's great for him to point out later. He's like, listen, we need to like think about treating the patient now and what's happening now.
And listen, as someone who like, my experience with doctors growing up, particularly in my teenage years, was like always focused around my weight because I grew up like overweight, and it was always about like, oh, you're a little heavy, like you need to eat less, you need to work out more, you need to like do all these things. Even when there was like something actually wrong, like there is genuine medical care that I needed that I did not receive because doctors were always focused on like, so what are you going to do to lose weight? So I think that's why I want to kill Ogilvy, because I'm like, yeah, I've been there, and fuck off, dude.
So we find out from Howard that he was in a car accident, and then he was in the burn unit, and then he's had 4 leg surgeries over the past 10 years, and because he was laid up so much, he lost his job, and so, like, things spiral. I don't think people realize, like, for me with my back pain, I've talked to, my doctor, and she's like, "Well, how are you eating? And, what are you," and I was like, honestly, I was like, "Girly pop, it depends. Does my back hurt? I'm eating ramen noodles or fast food because I can't stand there and cook something." Like, it's a domino effect, you
Right.
know? And if I'm in so much pain that I can't exercise, then I can't do the exercise that I need to do to gain the muscle strength to fix the back pain. It's an endless cycle. Like, it's awful. So
Right.
they're numbing his nose, the back of his tongue, his throat, his vocal cords. Like, it's like step by step. And it made me feel kind of claustrophobic, not gonna lie.
Yeah, it was like cool to watch though, like the whole tube process, but yeah, it was like
And
claustrophobic
how
for sure.
tedious it all was.
Yeah.
Like, we really stayed with this, like, step by step by step by step, and they're like, we're numbing this thing now, we're numbing that," and I'm like, "Jesus Christ." So many things are being numbed in this episode, by the way. Oh my god. So we have a patient with sudden onset blindness that comes in. Her name is Brooke, and she's with her wife, Wendy.
And I did say yes, lesbians out loud.
Let's go,
Because I
lesbians!
just have to
Let's go,
recognize.
lesbians.
I mean, either one of them could be bi, but like, you know.
Yeah.
Let's go whoa relationships.
Yes,
Willa
willa
willa. So she's got painless loss of sight in her left eye.
Honestly, that's scarier to me than like pain, loss of sight. Just one day, no feeling, no nothing. Hey, I can't see out of my left eye. Like, what the fuck?
Yeah, no, that would be really scary.
At least with pain, I would like feel it and I'd be like, oh, okay, there's a reason why I can't
There's
see out of my left
something
eye.
wrong.
Yeah, but if
Mhm.
I don't feel pain, I just go blind in my left eye. I'm like, fuck.
I'm like, did I accidentally pick my eyeball out of my head? Is she there?
Is
Hello?
it there? Hello?
So they're going through the differentials, and Mel says that one of them is something called an eye stroke, which panics the patients. And Mohan seems like briefly annoyed with her for this, but I'm like, it's not like violacious menstrual blood. That sounds worse to me, okay?
I don't know. I think the word stroke is very scary, like to hear.
You've lost sight in one eye, so.
Also scary.
We find out that the order sheets are missing the patient stickers. And I assumed that the patient stickers we're talking about are like the ones that they stick on the little bracelets, or your little wristband that you wear when you're in the hospital.
Sure.
The look that Princess, because Robbie's like, hey, there's no stickers on these. And the look that Princess gives to Larry and Antoine to be like, we'll fix it. Like, she is sick of them already. And like,
Yep.
honestly, I get it. I hate delegating, and then realizing that I could have done it better and faster.
Right.
Nothing makes me angrier at work is when I'm like, here, do this thing. And then someone's like, do, 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 do. And I'm like, oh my fucking
No,
God.
I know.
You're making me look bad somehow. Like, this is all about me somehow. Dr. Jefferson comes back down and he asks Javati if there's any more comatose patients for him to talk to. And Javati looks like he has threatened to hit her with his car. And then he's like, I'm just joking. And we get another wonderful, like, laugh from Javati.
I love her. I love her.
I do too. And he's brought down Nicole Stedman, and she runs a parent support group for the psychiatric service. And my note was just yes, with a million exclamation points, because I'm like, a Black woman who's here.
Yes.
She's going to come talk to these Black parents about, like, yes, this is what we needed.
Yeah.
Like, so, okay, all right, Dr. Ellis is not taking over, but we do have a Black woman there to help them navigate this. Thank God. Now we find out that there's no blood flow to Brooke's left eye, and so they very quickly are like, we're ordering a head CT. Dr. Al tells them to do like massage of her eye. The way she very quickly, when they're like, oh, there's no blood flow, and then she's like, boom, do this. And I'm like, ooh, scary.
This is serious.
That's urgent. This is serious. Also, I liked the fact that the tool that they were using to take photos of her eyes, it actually is like an iPhone in a thing, like in this camera lens thing. So that's why when they take the photos, it's the camera, like the iPhone camera sound. It's because it is an iPhone mounted on this device. So I thought that was cool. Now, Princess comes to check in with Dana, and they're kind of talking about how crazy everything is. And then Emma and Ilana come back, and Ilana is ready to finish up the exam.
Good for her.
Good for her. So we cut back. McKay and Ogilvy have gone to get a device to help Howard communicate since he won't be able to talk once he's intubated. And she tells Ogilvy to watch his dirty fucking mouth.
Yes, she says it exactly like that.
Yeah, exactly like that. And Ogilvy is like, I'm just wondering how he got so big and how we can help. And she's like, you can help him by shutting the fuck up and solving the actual thing that he came in for help with.
Yeah, you can help with the abdominal pain because
Yeah.
my man's not going to be doing any water aerobics until we take care of that. So,
Can't do water aerobics if you're dead.
right. Exactly.
So they go in. Abbott is going to slide his entire pinky into Howard's nose. My note was just like, Robert is going to say something about the absolutely bonkers banana pants crazy story of when they got appendicitis.
Yeah, guys, here's a crazy story when I got appendicitis. One day I got appendicitis. The end.
Thank you for that.
They still have appendicitis.
I never recovered. I've had appendicitis for 10 years. No, it's very simple. I went to the doctor. I went to the emergency department. I was like, hi. Initially, they wanted to turn me away because I was feeling the pain in the wrong area, apparently. And it wasn't until my dad was like, he's been in the fetal position like all day. They're like, oh, the fetal position. Okay, we'll give him I think it was a CT or whatever the fuck it was. We'll scan him. And then they're like, yeah, no, his appendix is about to burst. And we're both like, okay, cool. What are we going to do about that? And initially they wanted me to take antibiotics at first. And so we tried that for a little bit. And they're like, yeah, it ain't working. We got to cut you open. I'm like, cool. And that was my second major surgery in my life. Going under was weird because one second I'm talking to the surgeons and then the next minute I'm waking up and my mom's next to me. I'm like, what the fuck happened?
Mm-hmm.
Anesthesia is quite a drug.
We find out from Garcia and this conversation, again, they kind of step off to the side to talk about this, but if they end up needing to operate on him, there is a 50% mortality rate.
And this is devastating because I love him. He's so sweet.
He's so kind.
And just overall a lovely person. And I'm just like, no, he can't. He can't die.
Now, half of these downtime slips are blank.
Because we're using a felt tip pen.
Larry, I swear to God, you youngins drive me nuts. You never done a carbon copy in your life?
You've never written a check?
I've had a few forms to fill out in my life that were like, oh, carbon copy. And they're like, they usually hand me a pen in those scenarios to write with because they need a specific pen for, to fill out in triplicate or whatever.
But also like, why are you not using a ballpoint pen on
using a felt tip
form?
Pen?
Craziness.
Like the idea of using a felt tip pen to like fill in a form, like
I guess I'm imagining like a Sharpie, but that's not quite what it is. So like, but I think it's more of like those teeny tiny ones, with the tiny, tiny little felt tip that sticks out.
Like a flare pen. I don't know. If somebody handed me one of those forms, it's like a very thin front paper. Like I can't use a pen like that. It's gonna bleed.
It'll tear through or bleed. Right.
So like just what was the thought process? I'm dying to know because
there wasn't one.
I hate it.
Ugh. Digby is still missing. And I was like, I fucking told you guys. They're not like, oh, we need to find a place for him. No. Mans is missing.
Yeah,
they don't know where he is.
He went for a walk. Where'd he go? We'll find out in a little bit.
So Santos needs to present, and Langdon is like, what do you need? And she's like, nope. And she needs an attending, and he's like, or a senior resident? She's like, pass. Fair.
I need to say that I saw the most like Tumblr Wattpad bullshit as imagination of how Langdon is going to reconcile with Santos, and it was like, oh, he's gonna stop her from like relapsing with her self-harm. I'm like, no, what the fuck? That'd be terrible to write. No,
I do need these two to make up, and I need them to join forces because unfortunately they are so similar, and I think
it's the same person, different font.
Yes, they could really take this hospital by storm, and I need us to fix it.
I don't want them to be friends, but I do want Langdon to apologize so they can at least work together and not have this like very, very unspoken but very present like aura of beef. Yeah.
I also think he needs to thank her.
Yeah, he does.
I need I need Langdon to say thank you for saving
Yeah.
me. I'm sorry I was an asshole.
We need to dispel the aura of beef.
I either need them to be besties, or I need him to have beef with her the same way he has beef with Garcia, where it's like it's fun.
I think this was a good episode for them, though.
Yes.
She tells Dr. Al about the treatment plan and the trigger point injection. And again, here it is. Langdon says, "Nice job on the trigger point." And she says, "Yeah, I know." And walks away. She doesn't look at him. I loved this comparison to last season. I loved it. I loved the callback. It was great. Dr. Al spoke with an ophthalmologist at the VA about treatment for the eye, and it's not like standard of care, but she does really want to save this woman's vision. I will be very honest with you guys. Usually, if I'm like watching this show, most of the dialogue makes sense to me, or I can Google it to make sense of what's being said. But this conversation between Dr. Al and Robbie totally stumped me. I really didn't know like what was beyond the standard of care for her to have called someone at the VA, or what?
It's also pretty bold of Michael Cowboy Medicine Rabinovich to say that's outside the standard of care. I'm like, hello?
Yeah, Mike. What the fuck, guy? So
Sorry, the idea of calling him Mike Robbie.
I don't know what's worse, knowing that his first name is Michael or knowing that Langdon's first name is Frank. It's knowing that Langdon's first name is Frank by a mile.
I think Mike is worse.
Actually, like so many. It's honestly, it's mostly just the men that like their first names feel wrong. None of the. I guess okay. I feel the same way about Cassie McKay. I'm like Cassie doesn't feel right, but
What about Trinity Santos? Could you look at that character and just say the word Trinity?
yeah, I could.
Oh, okay. You used to have a problem with that. Not like a problem with that, but like you were like a little irked about that last season.
I did, but then I read some fanfic and got used to seeing her first name used to address her.
Mm-hmm.
Honestly, Garcia as Yolanda still like that one still gets me a little.
Oh
bit.
yeah, 100%.
So Robbie, this is like the second or third time in this episode that Robbie makes a comment about how he won't be around to find out or blah blah blah. And like he wants to leave so bad.
Or he wants to kill himself because the like I'm not gonna be around of it all, and I shouldn't be laughing because it's like if somebody in my life, if I was concerned about a friend like harming themselves and they were like, well, I'm not gonna be around, even if it was just like we're going on vacation, I would be like, whoa, let's unpack that. What do you mean? And the fact that no one does is like
that, but
someone check on this man. Not that he would share his feelings anyway because he's a man, but anyway.
Ilana is still having her exam done. They have to get 2 swabs of the vagina, 2 of the cervix. My note was, Robert, have you ever seen a speculum?
Yes, I have. Both in person and also I did just quickly Google it again to be like, I know what I'm imagining, right? And like, yes, I'm correct.
I hate those things. My number 1 op.
I have no comment either way because I'm not a hymen haver.
But yeah, they do have to swab her mouth again. This time it's for her own DNA. So it is still so heavy. And like, I think like we talked last week with Aaron about like the tediousness of all of it. And Aaron was like, at a certain point was like, oh my God, like get her out of there. Like just finish up already. And I'm still feeling that way. I'm like, we're into the 2nd episode of this. Jesus Christ, let her go. I get it, but I'm also just like, God damn. We did get some comments from listeners about sane nurses. Sarah Beth wrote in to tell us that in Minnesota, a forensic nurse examiner is somewhat equivalent to a sane. She said the thing is, a lot of hospitals don't have SANEs or FNEs because it's really expensive to train them, and it's not a big return on investment for hospitals because the sexual assault exams are paid for by the state according to federal law, so the hospitals can't charge the rates that they would like to, meaning that they're usually taking those exams at a loss. They're doing those exams at a loss. And so she said the training is specialized and it's not always widely available. It's also a really big time commitment for nurses to get trained, and many of them do it on their own time. It's also a really heavy subject matter, which narrows the field even more. She said the only thing that seemed a little bit like off was that there happened to be a SANE on staff that day. In Minnesota, she said that many SANEs are on call across the whole region.
Oh.
And so a lot of victims like have to wait hours before they're seen.
Oh.
And she also said that hospital staff will put a survivor in a room away from other waiting patients, but the wait might still be long. Sometimes they're asked to go to a different hospital that has a sane program. And she also said sexual assault advocates are amazing and they will show up 24/7 to hospital calls and stay there as long as they're needed. So thank you for that, Sarah Beth. That was very helpful. We go back to Jackson's family. Jackson likely has bipolar or schizophrenia, but treatment and diagnoses for those things it's basically trial and error. It's like, here's a medication. Depending on how you react to it, is how we can diagnose you, which is so terrifying, especially because anybody who's on any kind of medication for like a mood disorder or something like that knows that it's very difficult to figure that out. I got really lucky in that the very first thing I tried worked, and I've been on it for years. But there's also a thing where, like, for people with depression, you can do like a blood test to see which SSRI would be best for you, but that's like not covered by insurance and it's very expensive. And those are just the things that I'm like, why can't we just make that covered by like, why can't we make it more accessible so that people don't have to struggle with suicidal ideation that comes from being on the wrong medicine, you know?
You know, that's the dream. That healthcare would be accessible and, you know.
That's the whole thesis of the pit is healthcare is inaccessible. What the fuck? So Jackson's parents say, so we hope for bipolar. Now, do I think this was quite the right thing to say? No, because it did sound a little sassy. But to me, I really loved Javadi saying, you can hope for your son's happiness. I liked that because I was like, yeah, you're acting like he's dead. It's not a death sentence. I get that it's very overwhelming, but I'm also like, it's not a death sentence.
But I also think it's like a certain rethinking of like what you thought his future was going to be.
Mm.
And I mean, that's hard.
And Nicole does clarify, like, this is a new Jackson. This isn't the Jackson that you thought you knew. This is a new Jackson. Like, it's a learning curve. But they ask about Nicole's daughter because she starts talking about how 20% of people with early identification and treatment of schizophrenia make a complete recovery. And so they ask about her daughter, and Nicole says, well, she was 20 and she was diagnosed with schizophrenia. And his parents kind of have that moment of realizing they've stuck their foot in their mouths by being like, so we hope it's bipolar. Because it was kind of a little thoughtless, but still in the way that it's like, I get it. They weren't trying to be personally hurtful because they didn't know that. That's why they needed that connection with someone else who knows what they're going through, right? Howard is honestly kind of incredible with this device where you hit all the buttons to talk. I was very impressed with how quickly he picked this up.
Oh, yeah. And he continues to be incredibly charming and precious. And I love this guy.
Yeah. But he says, before I can't talk, I just want to say thank you for everything. I was like, I will cry. So Dana gives Ilana STI prevention and offers the morning after pill, but Ilana is like, no thanks. She's got an IUD.
Which is 99% plus effective, but it's not 100%. Very, very true. I don't know. Like most people, I can't be in this scenario, but I feel like, you know what? I shouldn't say anything. I'm not in the scenario.
Fair. So,
thank you for recognizing that.
I will say this reminded me of the sex ed I got in high school, which is every
don't have
time
sex, you will get chlamydia and die.
Yeah.
No, I didn't get the Mean Girls treatment. What I was told was like all the different ways of birth control, but every time, because I think it was a mandate from my school in particular for this teacher, he'd
Abstinence.
be like, he'd be like, condoms are 98% effective. You know what's 100%? Abstinence. And I'm like, my guy, we get it.
Dana excuses Emma. Emma has this very sweet moment of telling Ilana that she's a very brave woman and that it was very nice to meet her. And then Dana and Ilana have a moment privately where Ilana says, I'm glad you were here today. And Dana says, me too. And again, I was like, God damn it, I'm gonna cry.
Uh-huh.
And just like, thank you to the healthcare workers who really do show up and deal with us on the worst days of our lives, you know? One thing I think people say to keep in mind is like, the worst day of your life is my everyday life. So you have to keep that in mind while you're dealing with healthcare providers and things like that.
We cut back to Dr. Al-Hashimi, who's getting Brooks informed consent for a clot busting medication.
And it doesn't seem that, like, I don't know, it's like only 30% effective, and there's also like a 1% chance of really bad side effects and like death. And I was like, for only a 30% chance of it working?
But I was sitting here going, why? Like, isn't this the case with a lot of medication? Again, they lost me at the conversation with Dr. Al and Robbie. I don't understand what's so serious about this treatment plan. Like, I'm confused.
I don't know, man. I will say one of the funniest things about this shithole of a country we live in is that medications are on ads all the time on TV. And it's always really funny. They'll be like, oh, this medication will help you with your cancer. Side effects, it might give you more cancer.
Yeah. And then also, don't take if you're allergic to it. I'm like, no shit. No shit.
Yeah.
I love their little rom-com moment where, you know, she says, "What would you do without me?" And her wife says, "Figure out how to get by and probably cry for 2 years solid." And then Brooke goes, 2 years? That's all?
So funny. I cackled.
Because I feel like a lot of times you get the like, no, if I die, like I would want you to move on and like live your life and be happy. And she's like, bitch, you'd only cry for 2 years? And I love that. She's a woman who knows her worth.
Now, Jackie and Jackie come in.
Love them. Hilarious. Iconic.
Boy. So, patient Jackie is CK, and the other one is Q. Okay, so that's what we're going to call them. So, she bit down hard on her tongue. And so, it's Santos and Joy, and Langdon is going to supervise, which Santos is not happy about, but Langdon is like, everybody else is busy. As soon as I saw this chick's face when she was looking at Langdon and he leaned down, I was like, uh-oh, she thinks he's hot.
And they're like, oh, thank God your doctor's hot.
Camille, she's just like you, for real, for real.
For real, for real. Howard is now intubated, and they're going to weigh him. And so, like, that's just like we cut in, we find that out, we cut right back out. Now, Dana goes to open the fridge where they store the rape kits. And the cops, they're supposed to come get them within 72 hours. But there's a kit that she did 2 weeks ago that's still fucking there.
Ooh.
And I was so fucking pissed.
A-cab.
Well, and like just beyond that being shitty for the person who that belongs to, because that's like the evidence of the worst day of their life, that's also really shitty for Dana, who just put in all that time and effort into like doing this thing correctly, only for it to not even be collected. Like, that's so disrespectful. Pick up the damn rape kits. Do your fucking job.
Why do you want evidence in cases, but then when it comes to a rape case, you don't give a shit? Please. Oh my God. I'm pushing my soapbox away. I won't get onto it right now. But so we find out that the Jackies were taking selfies, and then Q like jerked her head up, which made CK bite down on her tongue.
Eesh.
I would not be able to cope, actually.
If you were the one who bit your tongue, or if you were the one, okay.
Yes. And also, like, this woman looks like she belongs in a horror film. Like, she looks like Carrie.
Well, I don't remember what it felt or looked like when I did it because I was like 2, but
because you were blackout drunk.
Yeah, because I was blackout drunk, right? And so like CK is also not gonna remember this because she is blackout drunk.
God. But the girls start fighting over whose fault it is, and Princess takes Q away, and they're gonna numb the tip of her tongue. And she's like, but I didn't bite the tip. And they're like, first thought, I thought there was going to be an inappropriate joke.
Just the tip.
2, because she was drunk, okay? So I was totally expecting something inappropriate. 2, Langdon is like, 1 step at a time. They're numbing the tip of her tongue so that they can literally, like, fish hook it and then pull it out of her mouth. Brother, I'm kind of queasy just thinking about this right now, not gonna lie.
I find it interesting what gets us queasy, because this didn't really get me queasy at all, as opposed to like rotating the lung did, for example.
Yeah, see, that didn't bother me at all.
So like, I guess everyone has their own level of queasiness.
Yeah, whatever happened to the rotating the lung guy?
He went up to surgery, and presumably he has a room upstairs somewhere, hopefully. Or they're still performing surgery on him, who fucking knows? So it takes an hour or 2 for the clot-busting medicine to kick in, and Dr. Halashimi wants Mel to stay with her to monitor her. That's quite a long time for Mel to just sit there.
Yeah, like, give her a task.
One of the complaints I saw from some doctors who were reviewing the first season of The Pitt is that, like, when they were doing the whole, like, oh, all the doctors who are O-pos, O-neg start donating blood, they were like, okay, but that's 10-15 minutes that you're going to have hands off of people and helping those people. And like I can see that. Sure, whatever. This is sort of the same ideology, at least in my brain, of like, okay, she's a doctor and you are currently going through one of the like roughest shifts of this hospital's existence, presumably. Why do you want to take her out instead of having her tend to more patients?
Right. I'm sitting here going, can't a nurse do this? We're talking about how the hospital's filling up and this is crazy, or the ED's filling up and this is crazy. But you can spare Mel? Like, can't a Nurse Jessie is there.
Yeah, it's like it's almost like she's trying to do Mel a favor and like give her some downtime, but I also like I don't think that's what Mel needs right now.
Right. So George, who's the D-dimer patient from a couple weeks ago, wants to talk to Mohan, and he admits that he didn't have any shortness of breath. He's just really anxious that the clot in his leg is gonna, come up and kill him.
Yeah.
And they have this little conversation, and he tells her,
Well, first he tells her that he joined a lawn bowling league. What is lawn bowling? Lawn bowling is where you try to roll a ball closest to a smaller ball. It's kind of like bocce.
Very Bridgerton. So anyway, he tells her that he's joined this lawn bowling league, but also that she was right, that she told him that everybody needs community, and that she was right. And I'm like, Mohan, you need friends, girl.
Yeah.
You've got your job and your mom. And she's kind of spiraling because she was about to move her whole life for her mom. But now her mom is going, and I'm like, yeah, girl.
And
get some
also, maybe you need to
friends.
sleep with the hot older doctor at your job. What? Who said that?
100%. Not at your job, but,
No, but, like, off campus.
Here's my next note. Yuck, 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 yuck. Ew, yuck.
And I stand by that. I've always said that.
Yeah.
Knowing that this is a prosthetic kind of helps it for me be less icky, but it's still kind of funny for me to imagine them like yanking on the tongue of a prosthetic.
I feel like this tongue was very obviously a prosthetic to me.
I didn't think so.
I'm
Really?
sorry. Camille thinks they actually stuck a hook through a person's tongue.
No, she just thought it looked really realistic. I thought it looked, and perhaps I've just seen too many like prank videos where people are using those fake tongues and now I can just like kind of clock them. But like, I don't know, this is one of the first times that like the medical stuff I've been like, oh, okay, that's a fake tongue.
Yuck. No, but just the amount of tension that you would have to pull a tongue. Isn't that one of the strongest muscles in the body?
Yeah, it is.
Oh.
Says the lesbian confidently. Anyway, Langdon's teaching and Santos ain't having it. Plus, she already knows how to do it. Langdon excuses himself, enjoys clocking the tea, which I found so funny. With her photographic memory ass, she's going to remember this and she's going to ask later.
I'm smelling an aura of beef.
God, first hymen havers, now aura of beef. I swear it. Like, what's wrong with me that I can't
That's
speak?
gotta go in our description for this episode, the aura of beef.
We have Dana on the phone ripping someone a new one, basically, and she's saying, you expect us to treat your officers as soon as they come in. You get a detective to pick these kids up ASAP. And I was like, get them! You tell them, Dana. I love having her spunk back in the ED.
Mm-hmm.
Antoine and Larry are still fucking things up. They're basically two stooges.
Oh my god. These two.
Everything is a mess, but Dana is like used to this and she's just rocking and rolling. She's like, she thrives in the chaos. She's got this. Now, Duke, we find out, the friend of Robbie's, he's a mechanic, but he still hasn't come in. And I'm like, yes, because he was in a motorcycle accident, clearly. He's dead somewhere. Take a shot every time in one of these episodes this season. We've been like, because he's dead. Specifically because we don't know, like we're not watching it in advance enough to know. So we're just like, must be dead, I guess.
Everyone is dead until proven otherwise. Like the cat in the Schrodinger's cat. The cat is dead until proven otherwise.
Now, when Dana said, she says, oh, princess, because a CT result has come back. And I'm so sorry.
I know what you're about to say, and don't say it. Don't do it.
Oh, princess. Like, was that intentional or no?
Dana
Because
gets out
Jesus
her fedora
Christ.
and...
Oh, princess. Ask and you shall receive.
I'm gonna explode.
Ooh, ick. Anyway. Yeah, I should quote myself from earlier. Yuck, 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 ew, yuck. So, Langdon and McKay are charting, basically, and Langdon is asking how McKay's day is going. And they start talking, and he mentions CK, which is the binge drinking party girl. And McKay says that it sounds like she needs some help. And then she asks Langdon about how his first shift back is going. She says the first year sober is the hardest. And Langdon says, that's what they keep telling me. And then she throws a curveball at him because I realized he doesn't know that she's a recovering addict.
But we knew this, yes?
We knew this.
Okay. I was like, we knew this.
We knew this, but he didn't, because in the first season, he literally tells Javati, I really don't know that much about her. She kind of keeps to herself. Like, she's got a son, I think. And then she says, I'm 9 years and counting. And the look of, like, hope on his face was very significant to me. I liked this moment between them a lot. I liked finally getting to see the two of them have a conversation like this, because he needs someone like that.
Oh, yeah.
Everybody else doesn't get it, but McKay gets it, and that's the kind of support he needs right now.
Yeah.
She tells Langdon to call her if he needs anything, and again, I loved this. Now, Ogilvy and Javati are both walking up to the same patient. Ogilvy took the chart, but Javati signed up on the board, and so they each get a half point, basically. But honestly, 2 student doctors, you put them together, you have one whole doctor, so.
Yeah, math.
You know? Yeah. Now, this guy has awful blisters all over his body.
Ugh,
It's not poison ivy. It's not like a new lotion or anything. It's painful. It's really itchy. Did you guys have any thoughts about what this was when you saw it?
No, because I'm not a doctor. I thought, yuck, 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 ew, yuck.
I also had no idea what it was. I had one of my first jobs was working in a Shake Shack. I was scraping the grill once after having cooked some bacon on it, and I scraped too hard back, and some of the bacon grease spilled on my arm.
Ooh.
And it resulted in similar looking boils like that. Fun fact, by the way, I had to ask my boss 40 billion times, can I please go home? Hi, my arm's in agonizing pain. And he's like, let me see if we have someone to cover you. And I just stayed there for an extra hour while they were looking for someone to cover me. Meanwhile, my arm was in fucking pain.
So you recognize this as a burn?
I thought it was a burn. I thought those were burn. It looked very similar to burns.
Technically it is.
Yeah, it is.
Technically it is. So, okay. Neither Ogilvy nor Javati have any idea what is going on here. But also, when they leave, he's trying to say something to them, and they ignore him and walk away. They didn't ask the right questions. Now, there's no changes with Brooke's vision, and it's time for a neuro check. This is my patient passport moment for the episode, okay? Dr. Ellis comes in to the trauma room and asks Mel if she's got a minute. And I was like, is there an aura of beef here? What is happening? Because Mel does not want to speak to her. And I was like, oh my God, what's happening? What is this? Now, Ellis is like, it's going to be 60 seconds tops. And they go into the hallway. And Mel, looks like she's got tears in her eyes. She's so overwhelmed. We find out that Ellis was also deposed, which is plot twist. Okay, this is bigger.
Yeah.
They're not supposed to discuss the case. And Ellis, this is the line of all lines, says this isn't a discussion, it's a monologue, so shut up and listen. I fell in love.
No, this is I already thought Ellis was hot. And
I like that you said hot.
Hot.
I would use my horny thought here, but actually there were no thoughts. My entire brain just turned into TV static in this moment. I was just
You're Pretty Woman told me to sit there and shut up. Yes, ma'am.
But also anybody with a praise kink is oh my God, because just the way that she's you did a great job. It was nothing you did, right? So basically, here's what's going on.
Ding, 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 ding. Camille was loud and right.
Yes! I think I said this in episode 1, right? Yes. I was like, what is this? The measles kid? It's the measles kid. It's his fucking mom. Basically, she's saying there was a mental decline because of the spinal tap that you did, which is completely unfounded, by the way.
Yeah.
And Ellis tells Mel, she's like, listen, the tap was perfect. Any mental decline, anything, was from a lack of oxygen, and that causes damage to the brain. A hypoxic brain injury is a brain injury that comes from a lack of oxygen. It is the death or damage. It's death or damage of brain cells. So that's what she's saying. It's like, you didn't do anything wrong. I don't want you to go in there without confidence and like start apologizing and then sounding like you're admitting something, right?
This does make me so sad for this kid, though. Vaccinate your fucking kids.
Vaccinate your fucking kids.
Mm-hmm.
We cut back to Howard. They weigh him. I love how we initially have the confusion of like 215. It's like, oh, Robbie's like, oh, sorry, that's kilograms. No, he weighs 474 pounds, unfortunately, which means he's too heavy for their CT. They don't want to risk breaking it on a holiday weekend, so they have to send him to Presby.
And Abbott is going to ride with him to monitor so that they will transport him because he's intubated, so normally medics wouldn't transport him. So Abbott's going to ride with him, and I love that Abbott's like, I can get a nap in. I'm like, go off, King. You deserve a nap.
That man routinely runs off of like 2 hours of sleep, and he's about to get 20 minutes out of that 2 hours.
No, I'm not convinced that Abbott actually ever sleeps, because I'm just like, why are you always at the ER, my guy?
Robbie goes to pat Abbott on the back. Love the continuity details. Goes pat on the back, and Abbott is like, because again, he was grazed with a bullet. Oh, God.
If he can take the bullet, he can take the pat on the back.
Oh, God. So as they're wheeling Howard out, he uses the little thing to say road trip. I fucking love this guy.
I love him, and I also liked Robbie's little chuckle. Like, I don't know what it was about like that particular chuckle, but I just loved it so much.
Yeah, they're all just very tickled by him, and I enjoy that.
Me too, bro.
He's also then on the same device as like, sorry for all this trouble. And this was one of my title recommendations where Robbie replies, it's okay. This is what we do.
Yes. Obsessed with the tenderness and the honesty of this line of just like plainly saying, this is what we do. It's the communication of, you should accept no less. You are not trouble. This is literally what I have signed up to do. This is my job. You are not causing me trouble, and you are not an inconvenience. I really appreciated that. I like that a lot. Like, okay, Robbie's winning some points back. Now, Giovanni and Ogilvy want to present to Langdon, but he's like, no, find somebody else. Like, I'm busy with this nasty-ass tongue, okay? Now, Santos says that she's drunk as a skunk, and Joy asks if they should take her blood alcohol, and Langdon is like, no, because it wouldn't change how we treat her, which is valid. Yeah, I was like, because in my head, I'm going, no, because it's not relevant. Why would you? I mean, as many reviewers have stated, we are not medical professionals. So, like, why would you? But Langdon says no, and then Santos says she's already sent one off. And then she asked Joy. This was another great moment to me, okay? This is the moment where I was like, Santos and Langdon are on their way to repairing this. Because Santos asked Joy if she wants to guess the blood alcohol. And Joy says, why would I want to do that? And Santos says, I don't know, because it's fun. And then makes eye contact with Langdon because this is a literal conversation they had last season about Louis.
Oh, yeah.
Louis comes in the afternoon and Langdon says, do you want to guess the blood alcohol? And she says, why would I want to do that? And he goes, I don't know, because it's fun.
Wow. You're really bringing all these like season 1 details. That's crazy.
She quotes him to him and then makes eye contact and she looks amused. And I was like, oh my God, we're going to be okay.
Yeah.
Girl who is going to be okay. I love that meme.
Like, my heart leapt in my chest because I was like, oh, I love this. So now we're finding out that Peds doesn't want to take Baby Jane Doe because Baby Jane Doe.
Right.
They don't want to take Baby Jane Doe because they don't want to put a sick baby in the nursery, but they also don't want to waste a private room on a healthy baby. So we have the catch-22 of like, it's a sick baby, but a healthy baby.
It's a sick baby, but not sick enough.
It's a bacterial infection, so you don't want to get all the other babies sick. However, there are babies who need private rooms, and if we give a private room to a baby who's not really symptomatic, then yeah. So they suggest emergency foster care. Dr. Al is like, please have your attending call me. I appreciated that she wasn't like, I want to talk to your attending. I liked the tone because that's what she's asking for is like, I want to speak with your attending, but not in like a, I'm putting you down sort of a way. I kind of compare it to earlier when Robbie's like, don't take this personally, but I need someone who knows what the fuck they're doing. You know, I need an adult. But this is like the same kind of thing in a way to me because this guy's like, yeah, absolutely. And it was just a very respectful way of making that request. I liked it. I don't know. Anyway, Maybe that's a false equivalency, but that's where my brain went. Now, Mohan asked Dr. Al about a fellowship and her thoughts. And Mohan is considering ultrasound toxicology and sports medicine?
Sports medicine, like, came out of left field to me.
Yeah.
Is that a sports joke?
Not even intentionally.
They're all very different, I think.
Yeah.
It's
Mm.
crazy.
I love Dr. Al's face when she's like, those are very different.
Yeah.
Like, I love her faces are very amusing. Like, her face acting is really fun to watch. During this scene, I noticed that Dr. Al is making tea, and I liked the detail of the fact that she's using like loose leaf tea and a little, I don't know what it's like, a diffuser kind of a thing, rather than a tea bag. Because I was like,
This is a real tea drinker.
this is a real tea drinker. And I was like, I liked that we had two brown women sitting at a table together. One of them is making tea, and it's not a tea bag. She's literally like scooping tea into like loose leaf tea. I don't know. I liked that.
Yeah.
I thought that was cool. Now, Mohan does have research experience because remember last season she told us she was working on a study that was about racial disparity in healthcare. And we find out that the White House cut her funding.
Fuck Trump.
Because fuck Trump.
Fuck Trump. Now, Dr. Al suggests geriatrics. And this, I was like, yes.
Yeah.
Yes. 100% yes. I see this for
She
her.
is so good with old people. Like one of the first, like the first
Jack
introduction.
Abbott.
Well, yes. The first introduction to her is her spending so much time with that older woman in season 1, right? Like that's what we first meet her because she's getting this woman's like entire life story when she doesn't have to. And Robbie's like, you gotta be faster, slow-mo. So like this is a great path for her. And she's also so great with the guy with the clot, except for, leaving him in the hallway for forever, but we're not gonna talk about that. But
everybody does that.
When they finally talk, it's like
he was fine. He was fine.
Well, I also think it's a good moment to remind everybody that Dr. Al and Mohan have worked together before at the VA.
Yeah, that's true.
So reminder, Mel, Dr. Al, and Mohan all work together at the VA. CK is still drunk as fuck. She is passed out. She's been blackout drunk, so she doesn't even remember like the injury or anything because they wake her up and they're like, we're done. And she's like, done with what? And they're like, you bit your tongue. And she's like, no, I didn't.
Like, yes, you did. They asked her
my
about her
God.
drinking habits, and she's like, oh,
and it's not good.
I have a couple of beers or a glass or two of wine with dinner. I drink on the weekends. And Joy is like, okay, should we recommend rehab? And Santa says you could try, which felt very, double meaning with Langdon.
Does Joy know about Langdon?
She shouldn't. This is like her first day, isn't it?
Right. So I don't think she knows. Oh, I wanted to say, of course, we do hear from our wonderful healthcare providers. Nurse Libby wrote in about discussing like gossip in front of patients. Remember when like Whitaker and Mohan and they were all talking about Langdon while they were working on the patient in the trauma and the patient was like awake? And I was like, is that appropriate? Do you remember that conversation?
Yes.
Okay. So Nurse Libby wrote in, and one of the things she said in her email, she said, you asked how much nurses really talk in front of their patients about personal stuff. A lot of us do. It depends on the situation, but little anecdotes about family or travel or pets make it into conversation frequently. We may talk more liberally amongst ourselves while working in the room on an unconscious patient, but it is 5,000% inappropriate to discuss anyone's addiction and recovery in front of a patient, especially because Langdon could be assigned to this patient who's just heard all of this discussion. It doesn't set him up for success, and it does not instill confidence in the healthcare team for the patient.
Thank you for writing in, obviously, but it's good to know that I was right. Woo, I get my one. I'm loud and I'm
ding,
right.
Ding, ding, ding.
I mean, personally, if I was the patient, I would love to hear your tea. I love to hear other people's drama that I'm not involved in.
Howard is on his way out with the medics and with Jack, and the last sentence he says to everyone, like with the little device, is, you guys are the best.
Like as he's being wheeled away. Oh.
I'm gonna miss him. I've grown quite fond of him.
I hope he doesn't come back. I loved him, but I hope he does. I'm feeling very emergency department right now. You were great. We love you. We hope we never see you again.
Mm-hmm. Now, Ring the bell, please, somebody.
Ding, 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 ding. Camille is loud and right.
Yay!
Digby was with Louis. Ding, 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 ding. Digby was with Louis. He was there for a whole hour because he and Louis were friends and he had a lot to say to him.
Yeah.
And oh God, as he walks by, Digby rings the bell and says Louis got his wings. My brothers in Christ, I was like, oh, I can't. Like, I can't handle this.
It's good to know that Digby has seen It's a Wonderful Life. I mean, it's a fantastic movie, public domain. You can watch it every Christmas,
I
but
haven't seen it.
fantastic movie. It's one of Mac's favorites, so I've watched it a few times. But again, shout out to me who has never seen Shameless, predicting or knowing the entire story of what happens to
Frank.
Frank. So you know what? Hey, they're chilling up above the hospital, sharing a drink.
Oh my God. Giovanni and Ogilvy go to present to Robbie, but like as they're starting to speak, Joy's like, it's a citrus burn.
I love her.
Like the layman's terms, citrus burn. And they're like, what? And she's like, yeah, I asked. He was making margaritas out in the sun.
Which it wasn't like an intended dig at them. I love those moments where just simply stating a fact, like destroys someone. You know what I mean?
Yeah. No, and so like I immediately thought of my baby brother because he and his girlfriend, Mal, you'll love this. They were like for my birthday a couple years ago, we went to the beach and he and his girlfriend were going to go drink like Coronas with lime on the beach. And I was like, please be careful with the limes. You don't want to burn yourself in the sun. And then like a year later, he goes like on vacation, whatever. And then he texts me and he's like, hey, you know, like after he gets back, he's like, oh, I had to go to the doctor because I've got like these, like I'm in so much pain. It's crazy. And he sends me this picture and I was like, oh my God. And he goes, yeah, you want to know what it was? And I was like, was it a fucking citrus burn? Like I fucking warned you about? And he was like, yeah, it was. Sisters, no, brother. I've never had one, but I knew it was a thing that could happen, and he didn't listen.
I did not know that this was a thing that could happen until I was yesterday years old when I first watched this episode and learned that this could happen.
Watching this happen, I'm like, I feel like I've heard about this from maybe another medical show because I definitely haven't seen it in person, or I've never had anyone in my life like have that happen to them.
If you've got citrus on your skin and you're in the sun, you got to get it off.
That's terrifying. I will be sure not to cut lemon. Shout out to all of like the 8-year-olds running lemonade stands on a hot summer day.
They're trying to kill us.
We find out that 12 patients need med refills. Cuts to Medicaid really bumped up the numbers in the ER. Plenty of folks don't have PCPs anymore. They just seek emergent care when they need it.
Mm-hmm. Yeah, they go to the emergency room to get med refills. And so Donnie's like, bro, I've got 12 patients in chairs. It's standing room only. And the 12 of them just need a med refill. Ugh. So Donnie is like getting really stressed out because he can't e-prescribe. And Dana is like, it's totally fine. Dr. Nord is here and she's got the slips, you know, all you got to do is put a patient sticker on it. And of course, you know, Donnie's like, what would we do without you? And she's like, you'd lay on the ground in the fetal position. I don't know.
Real.
So when they go back to tell this man about his burns, obviously I'm like the conductor of the hate Ogilvy train, so I'm gonna find everything about him to hate, but I hate that he very quickly tells the patient that his burns, like what it is, as if he's the one that made the diagnosis. Like he has this little smile on his face and I'm like, you didn't come up with this answer, you little bitch.
Yeah. No, this sucks. This sucks so bad. I
never want this man to win again. Stop letting him get little wins. Now, Roxy is still in a ton of pain. She's getting 10 mgs of morphine an hour. Robbie says to bump it up to 12. And Javadi and McKay are really concerned about that dosage on top of the other pain meds that she's already taking because it could cause her to stop breathing. And Robbie asks if they're familiar with the doctrine of double effect, which is basically treat pain. If there's a negative side effect, accept it, even if that negative side effect is death. I did find some studies that were saying that pain in hospice patients and palliative care patients is undertreated. And they're like, just help them. Like 25% of these patients are being undertreated for their pain. But so this is from the Stanford Encyclopedia of Philosophy. It says the doctrine or principle of double effect is often invoked to explain the permissibility of an action that causes a serious harm, such as the death of a human being, as a side effect of promoting some good end. According to the principle of double effect, sometimes it is permissible to cause harm as an unintended and merely foreseen side effect or double effect of bringing about a good result, even though it would not be permissible to cause such a harm as a means to bringing about the same good end.
A prime example would be if you're performing CPR, if you're performing chest compressions, you might break someone's ribs, and that's fine.
If you're doing it right, you should be breaking ribs.
Yeah.
I learned that today.
Woo!
No, I already knew that.
Look at our little medical professional. So again, like, she's in a lot of pain. They're worried that if they give her more painkillers, it could cause her to stop breathing. And Robbie's like, yeah, but also, like, that is very likely preferable for her now.
Yeah. And that's
a hard truth. If you're listening and you know what the answer to this question is, please write to us, pittcrewpodcast@gmail.com, because I want to know, what is your cause of death if you are dying of terminal cancer, and what ends up stopping your breathing is, like, essentially an overdose of pain medication? What's your cause of death?
I think, please write in and correct me. I think they would list both potentially. I think I know it was a thing when COVID deaths were, like, rampant. A lot of complaints from that side was being like, you shouldn't have listed COVID as one of the causes of death because they had, like, terminal cancer. And it's like, okay, both were detrimental to this person's life, and as a result they died,
because, like, the terminal cancer may not have taken them out at this moment if they didn't also have COVID, and the COVID may not have taken them out if they didn't also have terminal cancer. Like, it was both. It's an and.
Please, someone write in and correct me if I'm wrong. I think that's what would happen if she died from these circumstances where they would list both causes.
Porque no los dos.
Like, the final shot of this episode is, like, I think it's what, Robbie and Dana, they're like, how are we gonna handle this? And it's the whole ER is a mess. It's a bunch of papers flying around, bunch of people walking like chickens with their heads cut off.
Donnie and Mohan are arguing with each other. The fax machine isn't working, and they're like, is it out of paper? No, it's not out of paper. Like, oh my God.
And that does not bode well for our next episode.
No.
Y'all, it is 2:00. The show is going to go on until 9:00, but presumably most of these people's shifts ends at 7, because I don't think there's going to be, on top of a cyber attack threat shutting off all the systems of this hospital, I don't think there's going to be another layer of, like, surprise Pit Fest shooting part 2.
Or maybe.
No, stop it. Okay, do we want to take guesses on, again, now that we've got into this, what our mass casualty might be?
I am still sticking to someone blows up, like, one of those fireworks stores. I'm sticking to it.
Unintentionally or intentionally?
Pick one.
I'm gonna say unintentionally.
Okay.
I'm sticking with, I think we've hit our quote-unquote mass casualty event of the season. Like, the big thing of the season is just going analog. I don't think they're going to go with something bigger.
I disagree. Something else has to happen.
You just want these characters to suffer. Damn.
I think it would be odd to have, like, I don't see how Dr. Robbie goes home at the end of this shift and, like, gets on his stupid motorcycle and, like, rides off into the sunset. Like, it feels like he needs to be in every episode of the season, so why is he staying until 9?
There is the common theory that's going around that he leaves at 7 and he comes back at, like, 8:00 or whatever, having been in an accident.
As a patient, yeah.
Which, ties back to, like, earlier, oh, when I'm in here, I'm the boss. Now, when you're the patient, you're not. That's the end of the episode.
Yeah. You guys got patient passport moments?
Just Dr. Ellis.
You're stealing my You always steal my stuff.
I'm sorry. And I just want all the listeners to know that I did, like, a very cutesy little, like, tuck my hair behind my ears, like, Dr. Ellis, are you free tonight?
Robert, what's your moment?
For me, it has to be Howard leaving the hospital and, like, his last words. Hopefully last words, not that way, not in that way. But the last words we hear, you guys are great. And I just really like that. I really liked Howard so much, and I hope we don't see him again.
Yeah. Any final thoughts? I don't know why I ask that every week. You guys never, you're always like, We should turn this into a video podcast so that people can see how you guys stare at me.
Tell me what to think. I've never had a thought in my life, so.
Well, yeah, to reiterate, my patient passport moment was Dr. Ellis as well, so.
God, she's so hot. She's so hot.
And if that's all, so long, fellow losers. The Pit Crew podcast is created and produced by us, Robert, Mal, and Camille. It's edited by Robert. You can find us on TikTok, Threads, and Instagram at pittcrewpodcast. If you'd like to support our other projects, our socials are linked in the show notes. Our art is by Rand Pacoca. He can be found on Instagram at Rand Pacoca. All patient questions and concerns can be emailed to pittcrewpodcast@gmail.com. And this isn't a Taco Bell, but we do appreciate a 5-star rating and a review wherever you get your podcasts. Be sure to schedule a follow-up appointment with a nurse before you go. See you next time.